Now, let's talk health. Malaria remains a major infectious disease concern in Nigeria, with an estimated 65.4 million cases and 193,512 deaths in 2021. The country also has an estimated 1.8 million people living with HIV. Another infectious disease, Lassa fever, has continued to affect thousands annually in Nigeria. In 2024, more than 1,000 confirmed cases reported across 28 states, and there have been several discussions about prevention and management of these diseases. The World Health Organization says it continues to intensify its support to the Nigerian government as the Nigeria Center for Disease Control and Prevention and state governments strengthen preparedness and response. But joining me on World Now today is Dr. Godson Ndubweze. He's a public health physician and infectious disease specialist who has worked extensively across USAID PEPFAR-funded projects in Nigeria, particularly in high HIV and STI endemic regions such as Akwa Ibom, Anambra, and Delta State. He's a trained public health practitioner from Johns Hopkins University in the U.S. Dr. Ndubweze, good to have you join us on World Now. Before we explore current innovations in HIV prevention and digital health, let's talk a bit about your career in the medical field.
Thank you so much for having me here today. And I'm glad when you talked about all of the data and the challenges that are affecting us as a country. But before we get right into that, I started off with community, service while in medical school, and seeing those challenges enabled me to volunteer some of my time across different communities around my medical school then. And upon graduation, I started working with University of Uyo Teaching Hospital. And at the time, that was when the HIV pandemic was so much at the time, and there was a HIV surge implementation program that needed us to control the infectious disease in that area. And that moment became a defining time, especially when I started working with FHI 360 and Achieving Health Nigeria initiative, where one young lady who came to the hospital at the time where I was practicing at the time had issues with gender-based violence, and realized that she had consistent cough and all of those. To tell a long story short, she was diagnosed with HIV. And that was a defining moment in my life. And that happened from Akwa Ibom State, started working in Anambra State under some CDC-supported programs, and it's been, a fulfilling one for me.
Indeed, Dr. Ndubweze. Yeah, a long journey it's been. But tell us more about the Consent campaign. What exactly was its mission and approach?
Absolutely. Thank you for bringing that up, because the story I just told you about the young lady was what fired me up to work with a group of other folks in the space. And we started talking about gender-based violence. We started training some young girls in school, and of course the boys, to also, put them through on how they can defend themselves, how they can open up to talk about their challenges. And we were able to, help out in those rural communities, working with the leaders and all of that to prefer help. And that essentially was what that mission was, to make sure that people were able to speak up. We created some safe spaces for these, young girls and boys to speak up, whatever the challenges that they had. And that has, helped in that area to control this menace.
And beyond that, I understand you've also led some key initiatives supporting adolescents living with HIV, such as the Transition Preparedness Model. Can you describe how exactly that works?
Absolutely. So the adolescent age is actually one of the major focus of HIV control in Nigeria as it is, because that age makes at least about 2/3 of the population, and making of the major infectious numbers that we have in that space. So there had to be a targeted approach, and that involved, building some peer-led support system where we had to empower the adolescents living with HIV to take care of themselves, and of course to also teach others. And in creating those spaces, we made sure that we built in some places where they have to come and pick up their medications, and try to also empower them in such a way that they will be able to let go of every stigma. And we saw some tremendous results, and that model has been adopted across several states in Akwa Ibom State, in Cross River State, and some other major agencies have also adopted that.
Very quickly, let's shift to your recent work on digital innovation and mapping. How did you get started in this area? And what do you believe are the top priorities for policymakers and partners moving forward?
Innovation leads most of the things that we do right now beyond even the healthcare space. And there's something that we call the geo mapping, spot mapping, where we could look at the regions with high level of infectious diseases, and this cuts across HIV and the likes. So when we see a space, we see that there's a trend within this area. Looking through the map, that helped us identify some hotspots, follow the trend of those diseases, and in identifying cases, we're able to control them. And in looking through all of these things, and with the recent changes in fundings in this space and all of that, there are some policies that we should actually look into space, which part of those is making sure that sustainability leads the effort in what we are doing from the broader segment of what the government is doing in this space, and also tapping into biomedical innovation. There are PrEP in the space, where PrEP is what we call pre-exposure prophylaxis that we could actually take, especially for key populations that are affected, in these infectious diseases. Right now, even in the US, there's what they call the PEP, which they get to use some antibiotics for some major STIs such as syphilis, gonorrhea, and these are for key populations. And there are also biomedical innovations coming through in this space, which are long-acting injectables that you could just take twice in a year for people living with HIV. So these are some things that we could look to adopt. Understandably, there may be challenges in doing this thing because of the supply chain and operation in our country.
All right, Doc.
But this is where we are tilting towards, and of course, addressing inclusivity and innovation.
I get that point. And as we wrap up this conversation, I'm curious as to what you think we can do as a nation, considering the global funding cuts that's been experienced, especially in the health sector. What must we do as a country to attend to these health concerns head on?
So 2 years ago, there was a program that was started from, the government started, which they call the National Clinical Mentorship Program, supported by the CDC. That was a way to transit the program from donor agencies and implementing agencies down to the government ownership. That started, but because of the funding cuts, that stopped across certain regions. What we could actually do is to still find a way to build around the public-private partnership across board, such that once this money is cut, we are not caught on an emergency to really say, what can we do? As much as we are planning for the fiscal budget for next year, some of these things should be included as we gear towards, ending the HIV by 2030, which is the global targets that the UN-AIDS have. And more importantly, is also going to the primary healthcare centers, where we see much of these things happening, to strengthen those structures and, to support the workers in that space. And one thing I always say is, if we look, the HIV program in Nigeria is one of the robust infrastructure with digital system, EMR, and all of that. That is something that is even it's translatable to other problems that we have, chronic diseases, hypertension, DM and type 2 DM and all of that. But yes, basically looking at the public-private partnership, it would help.
Okay, so PPP is the way to go. Public health physician and infectious disease specialist, Dr. Godson Ndubweze. Thank you for talking to us on World Now.
Thank you so much. Thank you for that.